Hey, good morning, and welcome to the Uropatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet here every Saturday at 10:30 a.m. Central Time. And if you're watching this live, well, sort of live, because I do record these ahead of time. But if you're watching it when it comes out, great. Be sure to hit that subscribe button. We're glad to have you on board. If you haven't checked out our website, go to our uropatient.com website to learn more about the show. Best place to learn more information on the show, and the best place to see all of our past episodes. Also, we have these helpful handouts. Be sure to check those out. Almost every show that we have, we've got a handout for it. So there's always some good information to be gotten there. So be sure to check that out. And then today we've got a great show for you today. A couple of folks from the Tilla company, Tilla Care, are going to be talking about a unique product called the Uricap. What's the Uricap, you say? Well, it's a female external catheter. Now, there's been external catheters for male, but there really hasn't been much success in female catheters. So this one is something that's a device that's not placed inside the bladder, but just an external one. And it works really well, and it sticks without any kind of adhesives or things like that. So it's kind of unique. So Sandy Brunella and Kate and Christy Campo from the company are going to be talking a little bit about that. So let's bring them in right now.
We are very excited to be here to have the opportunity to talk about our unique product called the Uricap Female. There's no other external female urinary catheter on the market that works without suction and also has Medicare and insurance coverage. We are excited to share what our innovation includes and have some dialogue with y'all. The complications that are associated with urinary incontinence, as you know, are skin, infection, and the patient's quality of life. And not, and the cost of urinary incontinence management can be quite enormous to both the patient and the patient's family and caregivers, not to mention the cost of care that puts on our United States economic burden. Next, we're going to show you a 2-minute video as a foundation for our episode today.
Urine collection device. Uricap Female is a simple, comfortable, and quick-to-use device that enables effective urine management. The Uricap Female is assembled from the cap and the tube. Connect the cap to the tube. Connect the tube to a urine bag. Make sure they are firmly connected. Apply the lubricant around the edges of the device. Clean the vaginal area before applying the device. Hold the Uricap Female with your dominant hand. Place the index finger in the longer lower lip of the device. With your non-dominant hand, spread widely the inner and outer labia. Locate the top of the vaginal opening. The device is placed in the area above it. Attach the long or lower lip of the device to the vaginal opening. Using the free thumb, tip the cap upward to make full contact with the area around the urethra. Lightly push in and hold in place for 5 to 10 seconds. Close the inner and outer labia around the cap. Only then remove your dominant hand. Fasten the tubing to the securement device where the extension piece meets the drainage bag. Allow enough slack in the tube and secure to the inner thigh. To remove or change the cap, simply spread widely the labia and gently peel the cap from top to bottom. With the Uricap Female, the patient may enjoy a full quality night's sleep, all while staying dry, clean, and comfortable. Thank you.
So now it's important for me to let you know, how does the Uricap actually work? So we're going to talk about the 3 mechanisms of action that allow our really innovative product to work for the woman with urinary incontinence. First, we're going to talk about surface adhesion, and then labial folds and time. So surface adhesion is the force that allows 2 dissimilar surfaces to adhere to each other. And how that works with the Uricap, the medical grade silicone has water-soluble lubricant added to it, just like you saw in the video, and it adheres to the naturally moist surface around the woman's urethra. Those two forces combine allow the product in the woman's anatomy to gradually form a solid, secure attachment. The next mechanism is the labial folds. We all see these every day in our practice. They work very well as a mechanical force to hold the Uricap in place. And then the third and very critical element of the mechanism to hold the Uricap in place and form a good leak-free seal is time. So with time, what we are looking for is one of two things to happen. Either a naturally occurring incontinent event, or for surface adhesion to occur over the time span of an hour or less. And usually it's less. The combined effect of all of these forces is what makes our patented innovation work. So once surface adhesion occurs, the Uricap provides a mechanical barrier that actually covers and protects the urethra from external contaminants. And for a lot of women, the most common external contaminant is actually fecal contamination. So that is going to prevent an avoidable urinary tract infection. The urethra is also going to be a leak-free and comfortable area once the Uricap is applied. Just to summarize, the Uricap works using gravity to a standard urinary drainage bag and does not require suction or any adhesives to stay in place. And since no electricity or external suction is required for use, the patient is free to transfer from bed to chair and chair to bed without moving anything with them, and the device remains secure. It's important for me to point out that the Uricap is actually not recommended and intended for regular ambulation throughout the day. The best time to apply the Uricap is before a naturally occurring time of rest. So either before the woman takes a nap or when she's preparing for bedtime. Applying at bedtime means that overnight she has a good night's comfortable sleep being dry and not wet or changing paper incontinent products throughout the night. The device can be simply applied for a clean catch urinary specimen, which does avoid intermittent catheterization. And we're going to get to the topics of sustainability and cost in just a few minutes. So let's talk about how to order the Uricap for your patients at home. It is so good that we are actually now partnered with Men's Liberty Bioderm, and they are our distributor. The next slide shows the letter of medical necessity that needs to be completed by the prescriber so that your patient can receive the Uricap and the products at home.
Literally pulled these data from the internet. It's easy for anyone, but I just simply collated it here for all of us today. Not comparing to indwelling catheters because they serve a different purpose, but looking at pads, suction-based catheters, as well as the Uricap. Pads, diapers, briefs, and wall suction-based devices, or even external suction-based devices for urinary incontinence, to the best of our knowledge, have either no insurance or Medicare coverage or very, very limited. So the big takeaway for both of these is that the patient could spend as little as 67 cents per pad or diaper. There's no reimbursement for those. And for someone, if you look to the far right column, someone who may be using 6 adult briefs per day, that could range anywhere from $120 to $260 a month. Again, that's an out-of-pocket cost. Many women may wear an adult brief and also add a pad inside of that to help cut back on the costs and simply replace those pads. So it's really difficult. It's going to be very unique for each woman. For suction-based catheters, these are ones where someone purchases a suction canister and they use either a wick or a pad. These are not covered, to the best of our knowledge, by insurance, Medicare, or Medicaid. The actual suction-based device that you would use at home either uses a battery or it's plugged into wall electricity. They range in price from $590 up to $1,240. So a pretty big expense. And then they also need to purchase on a monthly basis the either pads or wicks that go with those. And again, I pulled these right off the internet. Those range from $6 per item to $72 per item. But the manufacturer's instructions include that these should be changed every 8 to 12 hours. So if you're using it around the clock, that daily cost can be anywhere from $16 a day and upwards towards $500 a month. The Uricap Female, for a woman who has the diagnosis of urinary incontinence for 3 months or longer and meets that letter of medical necessity. If paying cash, it's going to be close to $14 per day, about $400 a month. However, because Uricap is covered by Medicare, many insurances, and at times Medicaid, again, it's varies widely, that coverage can be zero depending on their insurance. And for Medicare, Medicare is going to cover 80% in total. That's going to be $277 per day, or about $83 per month. So depending on the woman's need, depending on the resources she feels comfortable using, whether it's one device or whether it's a mix of those devices, we always want to take into account how we can save our patient money by either adding Uricap for just the nighttime use, or if she's in bed or in a wheelchair around the clock, it may be appropriate for her throughout the day. So just some data to think about as you try to help your patient find the most affordable resource.
Thanks, Sandy. Thanks, Christy. That was really great. A lot of great information. Do go to tillicare.com to learn more information about how you can have how you can get the device, and be sure to mention it to your doctor if you want to try that out. It could be perfect for you. Good solution. Be sure to tune in next week for our next episode.